Good news for the more than 16 million people suffering with major depression in this country.
It's a genetic test that helps patients get the right treatment much quicker. CBS 2's Dr. Max Gomez here to tell us how this one works. Doctor.
That's right. And, finding the right medication for depression is largely a trial and error process. And that's partly because everyone metabolizes drugs differently, and we all have different receptors on our cells for medications. So some drugs work better than others. That's where genetic testing comes in.
In 2010, I went through a very traumatic personal experience that left me suicidal.
But Ronnie Shapiro had 2 children who needed her, so she sought help, which became an exercise in frustration.
9 different medications. I couldn't sleep through the night. I couldn't get out of bed in the morning. I gained 8 pounds. I lost 10 pounds. I wanted to jump out the window.
The problem with this common trial and error approach is that even if the right medication is eventually found, the patient is still at risk.
The longer that someone stays in depression, the more damage is done, not just to our brains, but even to other physical health issues. Cardiovascular function changes, and profoundly the suicide risk starts to increase. About 70 to 80% of all suicides, more than 40,000 a year now, are linked with clinical depression.
But now a new genetic testing protocol can dramatically reduce that hit and miss approach. It's called GeneSight. A simple cheek swab genetically determines whether you are metabolizing your meds in a way that makes them less effective, and also looks for drugs that are known to be more effective for your particular genetic profile. A major study presented today at the American Psychiatric Association meeting showed its effectiveness.
With GeneSight, we can actually get you on that right medication sooner, which actually improves remission rates by 50%. We actually improved response rates by 30%.
Ronnie's GeneSight suggested she needed to add a booster drug to her depression meds.
Within 7 days, I was back to being me, which is miraculous.
Now, the GeneSight study was used on moderate to severe depression, but the company says it will also be useful to determine the best or better medications for bipolar disorder, anxiety, and schizophrenia. It's really kind of the wave of the future, genetic testing to determine the medications that'll work, and almost as importantly, the ones that don't work, to spare you that time and expense and effort.
So you really know.
It's not 100%, but you can eliminate a lot of that trial and error and go right to the stuff that has a much greater chance of working for you.
Important. Thank you, Doctor.
Thank you, Dr. Max.